Hello everyone, so this video is to go through the process of how to explain how to use a peak flow device to a patient. This is an important skill that you're going to need to learn because this device is a device that a patient will use to measure their peak flow, and it can actually be exposed to a lot of error on technique, which would sort of invalidate the result. When we give it to the patient, we can give them a mouthpiece with it, so it can be a plastic mouthpiece. That mouthpiece is something that the patient will use, and it's something that can be cleaned and can be reused. Or we can use these disposable cardboard tubes, these mouthpieces that will go into the actual device. The mouthpieces we currently use have a cover over the end here, which has a little valve on it, and that valve allows the patient to blow into the device, but it doesn't allow the patient to inhale from the device. So if they take a breath in, they can't breathe through the device, which will hopefully reduce the chance of any kind of cross-infections. These devices, as I said, are disposable, so we can take them off and we can actually dispose of them in between patients. So if we want to explain how to use this device to the patient, we can do that however you decide to do that. But one way that we're going to show you is to demonstrate, we'll give an explanation and demonstrate how to use the device, and then watch the patient use it so so you can see that they clearly understand the process. So if I was going to give this to the patient, I would make sure they can clearly see that there's a movable dial on the front here. This dial will give them the reading that they want to take. This device reads from 60 to 900. And it's important that before they use this device, that dial is moved back to 0, and in between each reading, it's always moved back to 0. When they hold the device, they want to hold it straight out in front of them. They want to make sure that their fingers don't cover where this dial is going to move, and that they've got the mouthpiece in, ready to go. The ideal position for a patient to be in is to be sat up, or actually standing would be ideal, but some patients can't stand, so if they can only sit up, then that's absolutely acceptable. What we want them to do is take 3 readings, and we will always take the best of the 3 readings. The idea of that is that actually what we want to see is the best of those, and the 3 readings allows them to have some kind of error or differences in their technique. We really want to get them to have the best reading. So in order to do this correctly, I would explain to the patient to set the device up by placing the mouthpiece in, moving the scale all the way back to 0, and holding it level. You want to take a deep breath in once you've sat up nice and tall, breathe out, take another deep breath in, place it into your mouth, seal around the tube with your lips, place your teeth outside the tube but don't bite down, and breathe out as hard and as fast as you can, trying to move the dial all the way down. Take that reading, write it down, move the dial back to 0, and then have another go. So with the 3 attempts. So that's what we want the patient to do. If their condition allows them to have 3 attempts, because sometimes patients might be a bit short of breath, they might be able to do the full 3 attempts. Okay, so how I would do that? So hi Di, this is your device. What I want you to do is going to measure how hard and fast you can breathe out. So what I want you to do is take your mouthpiece, place it into the device, move the scale all the way back to 0, and take a deep, sit up nice and tall. Take a deep breath in, deep breath out, deep breath in, place it in your mouth, seal with your lips around the tube, keep your teeth outside the tube, and then breathe out as hard and as fast as you can. Once you've done that, take the reading, and then I want you to do 3 attempts. Okay?
Okay.
Can you have a go for it, please?
Yep. Sitting up. So.
Okay, excellent. And as you can see, that's 460, so well done. Okay, thank you, Rose. Is there anything to add?
No, thank you.
Okay, thank you ever so much. That's it. Thank you.